So in this video, I'm going to be talking to you guys about my experience in the OBED or the OB emergency room or OB triage or L&D emergency room. All of those words will be interchangeably used in this video, but mostly I'll call it OBED, which just means obstetrics emergency room. I decided that I was going to start a series for you guys since I mentioned in a previous video that there's lots of different areas within labor and delivery, and I do pretty much all of them. So I wanted to show you guys what a typical day is like in all the different areas of labor and delivery. If you're interested in that, go ahead and press the like button right now. I know it's early in the video, I know you haven't seen anything, but just go ahead and press the like button. It really helps the channel out a lot, especially if you're excited about the series coming up. And while you're at it, press the subscribe button and the bell just to make sure that you get notified whenever I do post. But my new posting schedule is going to be every Wednesday at 6 p.m. So be looking out for a new video from me every Wednesday at 6 p.m. Central Standard Time. So without further ado, we're gonna get right into the video. First thing I do when I get into work is I get report from our charge nurse. It's like night shift huddle basically. So they just tell us about all the patients on the board and they kind of run down what everyone is working with, like who everybody is going to be assigned. That way you know like kind of the acuity of the floor and then like who you should be trying to help if you have time. We work as a team on L&D, so you have to kind of know what everyone else is dealing with. We also grab our walkie-talkies and our phones, which is very helpful because like I said, we work as a team. So walkie-talkies, you can be like, hey, I need some help in here. Ooh, I need a witness in the med room. Ooh, I need a witness on these meds in room 72. This is also when we get our assignments for the night. So in this case, they told me that I was going to be in OBED, and then everyone else got their assignments. We're typically on a 1-to-1 ratio on labor and delivery. If you have two patients, they're a little bit less acuity, meaning that they are doing cervical ripening, or they may just be an antepartum patient, which I'll go into in a different video, or you can leave questions down below. For OBED, I would go to my little area, which is in the front of the floor, right when people come in. That way we can triage them and see if they need to be admitted. So I clean off my little station, get a report from the day shift nurse that had OBED. So we have an SBAR format. We include the gestational age of the patient, which would be like patient is 34 weeks, out of 40, whatever weeks they are out of 40. It would include their G's and P's, which is basically how many pregnancies they've had and how many actual babies they've given birth to. Usually important to know whether they've had preterm babies or abortions in the past, miscarriages, abortions. Typically also want to know who their doctor is and what their chief complaint is, why they came into OBED. Also, it's important to know what their strip looks like on the board. And when I say their strip, it is a combination of baby's heart rate at the top, which is usually a blue line, and then at the bottom, which is usually a green line, is the uterine activity or how the uterus looks. So if they're having contractions, it will show up on the bottom line, and it'll typically be like a little hump. Example here. And then I check and make sure we have all the equipment there that we need. I check and make sure all the triage rooms are like set up and ready to go. Making sure that there's monitors in each room to monitor the baby and the mom's uterus, which is called the ultrasound and the toco. I will make sure that there are bands in the room to strap down the monitors. I will make sure that there's pillows, blankets, sheets, the bedside table, a gown, all of these things, you know, that are typical in a hospital room. That's pretty much it as far as setting up for the day. Throughout the shift, what it kind of looks like is if there's patients there, then I'm charting at least every 30 minutes on the patient unless they're really far along. Then I'll have to chart every 15 on the strip. So I'll have to chart baby's heart rate. I will have to chart the uterine activity, and you know, just repeat that every 30 minutes. The same report that we give from shift to shift, we will also call and give the OB hospitalist whenever there is a new patient that comes to the floor. We will have to call and give the OB hospitalist report and let them know, you know, what they're looking like, what their complaint is, what their baby looks like on the monitor, how many weeks they are. Typically, we see patients over 20 weeks. So if you come to the ER and you're over 20 weeks, you won't be seen at the regular ER. You will come straight up to labor and delivery floor and be triaged there. So typically we see 20 weeks and up, and we see complaints from broken water, high blood pressure, vaginal bleeding, contractions, round ligament pain, nausea, vomiting. Hey, future editing Brianna here. The biggest thing with OBED is making sure that you prioritize the patients that are coming in. Even though I said we only have 4 triage rooms, sometimes we can have more than 4 patients on the floor that need to be triaged. So it's all about prioritizing, making sure that the person that needs the most help the fastest gets it. If you need to get the doctor there stat so that they can assess a patient, then you need to do that. If you need to get somebody there so they can admit a patient, you need to do that. If you need to get an IV so you can push some meds so that you can stop them from having high blood pressure and seizing, then you need to do that. So it's all about prioritizing, doing your assessment, and making sure that the patients get the help that they need based on their chief complaints. You don't know what to do, but like literally anything can walk in, so you don't know what you're getting in for the night. Or it could be a completely simple night, which is unheard of. We have a pretty busy labor and delivery floor, so that's really unheard of on our floor. You usually have at least 3 to 5 patients, and on a busy night, you can see up to 12 to 20 patients in a night. I think that's it. I thank you guys so much for watching this video, for tuning in. I hope you guys really enjoyed this video. I hope you learned something from it. Hope you got something from it, you know, became more interested in labor and delivery, or maybe even emergency room nursing. Yeah, go ahead and press the like button if you haven't already. Go ahead and subscribe if you haven't already. And if you have questions, please leave them down below. Or what's your favorite part of this video was? Leave that down below. And I will see you guys in the next